All right, so we're going to get started. Hello, everyone. Welcome to the first Lab2Doctors seminar for the year 2026. We are very excited to have you here, and I hope we see you here again for all the other amazing seminars that we're going to have throughout the year. For those who may be unfamiliar, Lab2Doctors is an initiative that was created to stand as the intermediary between medical labs and healthcare professionals that may request and interpret lab results for their patients. In today's seminar, we're going to be delving into the importance of lab-focused continuing education for healthcare professionals, and we're going to be interpreting the results from a survey that I'm sure some of you filled out that was open for a month between December and January. And before I say too much, I'm going to be handing the mic over to the founder of Lab2Doctors and our in-house expert, Dr. Chessie, to give us a very rich, informative session. If you have any questions that came up throughout the session, please just put them in the chat and we are going to attend to you at the right time. Thank you, Dr. Chessie.
Thanks, Tammy, and thanks for the introduction. Welcome again. This is Dr. Chessie. I am the founder of Lab2Doctors. Like she said, Lab2Doctors was found to bridge the gap between the lab and the doctors. We realized that there's a lot of errors that we call lab errors. For the purpose of this webinar, we want to address lab errors. Where do these errors come from? So I'm going to share my slides as I begin this presentation. Let me hide this so I can speak without it. Let's see. Hide. Okay, good. So welcome again. The title of our presentation is Advancing Continuing Education in Laboratory Medicine. This presentation was based off of results we got from the survey we launched from December 18th to January 18th. It was very informative. It's been known that there's a lot of lab-generated errors that leads to medical misdiagnosis. But we also know that the lab has become so automated, especially in this day and age where there's AI everything. You can basically walk into the lab and your body turns on the instrument. Like we've reduced the touch points. Reducing touch points means that we've reduced the number of human-generated errors. But why is it that we still have so many errors that are called lab errors? Today, I'm going to make you know that there are so many stakeholders. When it comes to this word lab errors, these errors really do not just come from the lab. So what are the sources of lab errors? As you can see here, we have any of these people could be one of you, a healthcare professional, a clinician, a phlebotomist, a nurse, a lab technician, the lab director, all of us. When we are working, doing our job, at the center of it all is someone, and it is a patient. It's because of this patient that we are working so hard. Every direction is pointing to the patient. We want to make sure that we get accurate results for timely and accurate treatment and diagnosis. How can we do it? So in the lab medicine space, we have different phases of testing. We have analytical, pre-analytical, we have the pre-analytical, analytical, and post-analytical. The slide in front of you is going to be talking about the pre-analytical phase of testing. In the pre-analytical phase of testing, it is basically the phase of testing that is what happens before the samples reaches the lab. What happens before that sample reaches the lab? That is the pre-analytical phase of testing. You would agree with me that it says before the sample reaches the lab, yet when an error occurs in this phase, we call it a lab error. Why is it a lab error when I am in the lab and I've not seen that sample? Who are those who have a role in these errors that happen from out of the lab? We have the clinician, nurse practitioner, physician assistant, registered nurse, licensed, the LPN, the phlebotomist, the pharmacist who is not on this chart. So all of you have a role to play in determining the test. So for example, when it comes to determining the test that is needed or explaining the purpose of the test or preparing the patient, looking at the chart, you realize that the clinician, the nurse practitioner, and the physician assistant equally have roles to perform this. So in a practice setting where you have all of these people, who does this? Who is responsible for this? Is this person properly trained? Does this person have the right lab-focused education to ensure that they are doing their job accurately and making sure that they are not introducing errors that will be sent to the lab? Likewise, when it comes to identifying the patient, collecting the sample, labeling the sample, transporting the sample, the RN, LPN, and phlebotomists are responsible for this. Again, in some practices or some practice settings, phlebotomists are hired in the place of registered nurses. LPNs are hired in the place of registered nurses. What does this mean? It's true that you pay a phlebotomist lesser, but is the phlebotomist equally as trained as your registered nurse? That is a question for you to ask in your respective practices. It is known that 45 to 68% of errors in 68% of lab errors come from this phase of testing. Can you imagine the errors that you may be contributing to your patient's results? It's important that you know, and this is why we set up this webinar, that when we start right, we'll be able to eliminate these errors and have the right results. Instead of having patients on treatment that is not working and you keep on trying medications, changing doctors, and it goes on, and we are not identifying where the source of the error is. This is a lot of errors to happen in the pre-analytical phase of testing. Let's look at the next phase of testing. The next phase of testing is the analytical phase of testing. The analytical phase of testing, like it says analytical, it means testing performed in the lab. In the analytical phase of testing, you don't have a clinician, nurse practitioner, PA, RN, or LPN. Rather, you have the phlebotomist and the lab technician. Everybody who works in the lab is in the analytical phase of testing. Sometimes the phlebotomist would be in your offices, or they would be where they're working with you at the bedside of the patient. So this phlebotomist is not in the lab, and the phlebotomist is collecting the sample or operating the point of care testing instrument. What does this mean? Is it possible that this phlebotomist doesn't have the right training? If this is the case, you can always reach out to Lab2Doctors to ensure that the people you have on staff are properly trained to eliminate errors that will lead to misdiagnosis. It's also known that 2.6 to 13.5% of lab errors, as they call it, originates from this phase of testing. In as much as it's not as much as the pre-analytical phase, every error can kill a patient. So I wish we could get to the point where these errors called lab errors do not even exist. That's really where I want us to get to. The last phase of testing is the post-analytical phase. This is after the results are produced. Who are the stakeholders? Who are those responsible? Here we have the clinicians, nurse practitioners, PA, and sometimes the RN. And so you realize that it's a lot of people, but now it depends on the setting and the supervisors. Who has this role? Who is responsible for this role in your practice setting? Is that person trained? Does that person have the right tools they need to do their job? I know that towards the end of the year, people are usually looking for continuing education content to be able to meet the job requirements. I ask that supervisors, head of departments, CMOs, and the nurses themselves should reach out to Lab2Doctors to meet these needs. Get some of your needs to empower yourself, to make sure that you're well trained to eliminate these errors. Because these errors could just be your family member. It could be on your mom. It could be your dad. It could be your son. What about you? If you do your due diligence in taking these errors away, then the lab errors will no longer be a term that exists. And it's also known that in this phase of testing, 18.5 to 47% of errors occur in this phase of testing. So you can imagine the role you have in eliminating these errors and making sure that we become error-free and that lab errors is no longer a term that exists. I think we can all do it if we take on our respective responsibilities to see that this doesn't happen again. As you've seen from the charts, a lot of roles in healthcare overlap across the different healthcare providers. So looking at this chart here, when you see a green tick, it means that a green check mark, it means that all of these professionals equally perform the role. All of them can order the lab test. They can all collect the sample. They can administer medications. They can educate the patients. It goes on and on. If you see an asterisk next to the check mark, it means that it varies by setting or supervision. Sometimes in a setting, they would prefer a nurse practitioner doing it and not a registered nurse. In a setting, they may prefer a phlebotomist doing it and not an LPN. Sometimes these choices may be driven by the cost of hiring the right person. Remember, when it's good to make it's good to run businesses that that are profitable, but we should also put the interest of the patient in focus as we decide on who to hire for our practices. Lab-related roles of healthcare providers vary by care setting. When we say care setting, it means, for example, we are looking here at, so when I say team A would be the clinician, physician assistant, and the nurse practitioner. And team B would mean every other person, like LPN, RN, and the phlebotomist. So when it comes to ordering the lab test, whether it's in the hospital, emergency department, outpatient clinic, long-term care facility, you name it. At this point, ordering lab tests in the people who are responsible are team A, that is the clinicians, nurse practitioners, and the physician assistants. So you realize that there are different people. If the clinician is trained and one day the clinician is not there, I think it would be nice to equally make sure that the nurse practitioner or physician assistant who is on the team is equally trained to be able to order a lab test and not ordering the wrong test, ordering, let's say, cholesterol in the place of LP little a. Those are two different things, you know. So when it comes to collecting blood specimens, whether it's in the hospital, outpatient, or long-term care, you realize that team B is responsible for this. Again, please, if you have all of these people on team, the day that your RN calls in, be sure that the phlebotomist who is on staff, is equally capable of doing this and not compromising the quality of the sample, thereby introducing errors in the results. Team A is also can also perform this role, but then it depends on the specialty and the supervision. Or if you do not have a member on Team B, the people on Team A would also are able to do collect the blood specimens. When it comes to performing point of care testing, who is responsible? You have nurse practitioners and PAs and RNs and LPNs. So you realize that it's a mix of team A and team B. Again, I'm emphasizing this because I really want to bring to your attention that the roles, that when it comes to lab errors, these errors are not just generated in the lab. You have a role to play even when you do not work in a lab. And also the clinicians and phlebotomists have a role to play when it comes to performing the point of care testing. When it comes to labeling samples, we have team B. And team A can also label samples. I guess it depends on the setting and if there's nobody available from team A. So it's equally important. As small as it looks, labeling a sample, what could this mean? If you mislabel a sample, trust me, you've killed somebody else. You're causing somebody else to get the wrong medications, wrong treatment, and the person you're actually causing somebody's life. So it's important that irrespective of who you are on the team, if you know that you are on standby to simply label specimens, know what it means, know the skill that is required. Sample prep for transportation. Who is responsible for this? Team B, the RN, the LPNs, and the phlebotomist. You realize that in Team A, they don't do this. But you want to make sure that if you hire the phlebotomist because you will pay them $14 per hour, over $35 per hour, make sure that they know what they're doing. Because when it says sample prep and transportation, the sample has to be transported under the right storage conditions. And so we're not just looking at a robot doing this, we are looking at mindful service from the person responsible for this. Why choose Lab2Doctors for lab-specific continuing education credits? At Lab2Doctors, we provide lab-centered and clinician-connected continuing education content. No need looking so far, looking far away for something. If you come to us and you really want your team, you really want to know how to eliminate these errors, you want to please your patients, you want to make sure that when you diagnose them for the first time, it is accurate, it's coming from the right results, then just come to Lab2Doctors for lab-specific continuing education content. We also serve multi-audience, different audiences have accessibility to our webinar continuing education content. That is whether you are an internal medicine, geriatrician, pediatrician, you're a lab professional, you do just point of care testing, you see outpatients, whatever it is, we meet your needs based on based on your patient population and your role. So last but not the least, the content is customizable. If you want us to have a webinar with your team, if you want us to provide continuing education content that only speaks to your pediatric practice or your internal medicine practice, we would make sure that we sort information of issues that would normally come up in your setting and provide it to you. Look no further. If you reach out to us, you will be able to get the right content. And for this webinar, I had two of my colleagues were also supposed to be here, but due to weather and other family-related issues that came up, they couldn't attend. That's Dr. Brandy and Dr. Caroline, that you see their pictures here. But know that this is a very large team. We are a team of medical lab professionals. We are a team of laboratory medicine experts that make sure we are bent on seeing how we can eliminate these errors that happen to ensure that patients can get the right diagnosis and the right treatment at the first trial. So our contact information is right here on the screen. Meanwhile, I made mention of the nurse practitioners and the MDs. Previously, just so you know some of the things that nurse practitioners have told us, I'm going to tell Tammy, please, can you post in the chat window the link for the webinar we had with nurse practitioners, the webinar we had with Dr. Nan as a representative of clinicians. And also in the link, in the chat window, I would like you to post the link to Lab2Doctors website. Anybody who is interested in knowing more of what we do and how we do it, please do not hesitate to check out those links that will be posted in the chat window. At this point, I'm going to talk next about the results of the survey that we had. For the survey, most of the participants were clinicians, as you would see from your left to your right. Clinicians, there were about 95 clinicians who participated, laboratory professionals, almost 70, other allied healthcare professionals, almost 45. We also had nurses in different varieties. Nurses participated, pharmacists participated, I think 33% or 33 pharmacists responded. We also have people who are data analysts who analyze the data that comes out of the lab, who are in the IT. Lab also has an IT department. These are the people who responded. We also met with early career professionals and students, because sometimes some of you here, you probably have family members who are doing a biology or chemistry degree, or they graduated with these degrees and they don't even know where to go to. They're wondering, what do I do with this biology degree? We are also providing mentoring sessions to meet the needs of these people, to let them know how they can get a career in lab medicine. So if you know any of them, you can point them to Lab2Doctors to make sure that they don't graduate and it looks like they spent 4 years doing the wrong thing. And last but not the least, we have some people that who did not indicate their professions, but I just want to show you that a lot of people participated in the survey that have led to the results that shall be announced going forward. Thank you for listening, and I will pass it on to my team who will be announcing the winners of our survey.
Okay. Thank you very much, Dr. Chessie, for that very informative session. I'm sure we've all learned a thing or two about the medical lab to healthcare professional pipeline. And thank you to everyone that filled out the survey. Your responses are very crucial in making Lab to Doctors better at what we do and allowing us to serve you better. And after analyzing the data from the survey results, we were able to highlight some key barriers to accessing quality continuing education, factors that have to do with cost and scheduling. And so, by addressing these barriers, Lab2Doctors is able to serve as an accessible and effective bridge between medical labs and the healthcare professionals that Dr. Chessie spoke about. So, we are now going to move over to the exciting part of this seminar. We're going to be dealing with our survey giveaway and the raffle draw. So, just for some general housekeeping, the top 20 earliest responders are going to be receiving Amazon e-gift cards. And we have other gifts for people that participate in the survey as well. We have 10 $100 sponsored continuing education courses. We have three $50 scrubs or work uniform gift cards. We have three $100 Amazon gift cards. And then our top referrals will be receiving one top referral will be receiving an 11th gen iPad, and another one will be receiving a Fitbit Versa 4. So we will now be waiting for our raffle facilitator and we will get to the fun part. So we're going to be announcing our top 20 early responders. If you hear your name, congratulations. We will reach out to you. Congratulations to David Ajibade. You have won an Amazon gift card. Congratulations to Williams Wilfred. Congratulations to Penny Hemsworth.
Where's this noise coming from? Please, can you mute yourselves if you're not talking?
Congratulations to James Harvey and Michael Smith. Congratulations. Alif Raymond. Juan Lee, Damon Dash, congratulations. Lewis Hamilton, Thomas Johnson, Bar Javier, Thomas Brown, Mike Ballard, David Porter, Emily Cochran, James Smith, William Lunsford, John Johnson, Daniel Folland, and finally, Milo Terry. So, a quick congratulations to everyone that I have just listed. You are among our top 20 early responders, and you will be receiving Amazon e-gift cards. Now we're moving over to the general raffle draw, where we are going to be doing 16 draws for the gifts I mentioned. And I just want to note that the 132 participants that might be showing on the raffle system are individuals who completed the email verification process. So we can now start with the general raffle draw. Congratulations to Johnson, Maine. You are one of our lucky winners for one of our amazing gifts. You can have the next draw. Congratulations to Peter Chills. You are another amazing winner. Congratulations to Jasmine Smith. The winners that I have just mentioned are winning sponsored continuing education courses. Congratulations to Jason Smith. You have also won a sponsored continuing education course. James Collins, congratulations. You have also won a sponsored continuing education course. Mhm. Congratulations to Thomas Johnson. You have also won a sponsored continuing education course. Congratulations to Victor Balema. You have also won a sponsored continuing education course. Won Lee, congratulations. You have also won a sponsored continuing education course. Congratulations to Joseph Brown. You have also won a sponsored continuing education course. And the last winner of our sponsored continuing education courses is Alif Raymond. Congratulations. So the 10 individuals I just listed are winners of sponsored continuing education courses worth $100 each. So we're going to proceed with the raffle draw, and we're going to draw three times for three $50 scrubs or work uniform gift cards. Congratulations to Jennifer Rudiger. You have won one scrub or work uniform gift card. Idris Kayode, congratulations. You have also won a Scrubs uniform work gift card worth $50. And finally, the last winner of our Scrubs or work uniform gift card is Bakare Idris. Congratulations. Okay. So the next three sets of draws for the general raffle will be for three $100 Amazon gift cards. Let us see. We have James Harvey. Congratulations, you have won $100 Amazon gift card. We have two more winners from our general raffle draw, and one of them is going to be, let's see. Magda Jason, congratulations. And then our last winner out of our general raffle draw for a $100 Amazon gift card is we have Williams Wilfred. Congratulations. So these are all the winners from our general raffle draw. We will be reaching out to you personally to get your information details and to distribute the gifts. We will now be moving over to the raffle draw for our top referrers. We're only going to be doing two draws, and the prizes at stake here are an 11th gen Apple iPad and a Fitbit Versa 4. So let's see who our lucky winners will be. We have Chris Martinez. Congratulations. You have won a Fitbit Versa 4 worth 250 US dollars. And now for our 11th gen iPad. Let's see who our winner is going to be. Damon Dash, congratulations. You have won an 11th gen iPad worth 400 US dollars. Congratulations to everyone that has won. Please check your inbox. We will be reaching out personally to facilitate how we're going to get your prizes to you. Thank you once again for participating in our survey. As I said prior, your responses mean everything to us at Lab2Doctors because it helps us serve you better. And I will now quickly be handing back over to Dr. Chessie for some closing remarks.
Thanks, Tammy, and congratulations to the lucky winners of the survey. We appreciate everyone who participated. We've not taken your responses lightly. They've helped us to formulate the survey that we believe is needed for healthcare professionals who do not work in the lab. I know together we shall work to eliminate this term called lab errors because we're going to work as a team. Going forward, you've seen what I've shown you. You are now aware of the errors that you may be contributing ignorantly, consciously, or unconsciously. I now urge you to go back to your teams, speak to your supervisors, speak to the head of your hospital, speak to your colleagues. If you see anybody it seems as if they need more training, they need more information, help them by redirecting them to Lab2Doctors. Just so you know, our continuing education content is very, very affordable. Should be the least amongst our competitors, amongst all the others who provide continuing education. And there's nobody out there that whose continuing education content is as lab focused as the continuing education provided by Lab2Doctors. Together, we will work to eliminate this term called lab errors because we shall do a due diligence now that we are informed to go back and ensure that we know how to eliminate these errors and ensure accurate results for rapid diagnosis, treatment, and monitoring of our patients. Thank you. I'm going to give you the rest of your day and wish you good luck and enjoy your weekend. Bye-bye.
Have a good day, everyone. Thank you for joining.
Do not hesitate to check out the links that were posted, just so you are aware of what we do on Lab2Doctors. Check out the YouTube videos that we had interviewing next practitioners and interviewing a clinician, so you can see for yourself what it means, where the gap is, that gap that Lab2Doctors is trying to fill. Do not hesitate to watch. Click those links, save them for yourself, and watch it at your convenience so you know exactly how we are out there to ensure that these results are eliminated. Thanks again.